Is open to anyone 16 or older in Massachusetts. That means more teens are rolling up their sleeves. And here to talk about that and COVID-19 is Dr. Rick Malley, an infectious disease doctor at Boston Children's Hospital. Dr. Malley, good to see you. Thanks for being here.
Nice to see you.
Well, so we know the Pfizer vaccine is authorized for 16 and older, Moderna 18 and older. Are there any side effects that you're seeing in younger people that parents should be aware of?
So far, no, it's been a very similar type of side effect that you see in older adults. And in fact, we've also heard that even as young as 12 years of age, up to 15 for the Pfizer vaccine, the side effect profile looks very encouraging as well. This is the reports from the company itself. So it's all very encouraging.
Yeah, that's good news. Okay, state data shows over the last 2 weeks, people 19 and younger actually accounted for about 28% of all new COVID cases. So what more can parents do to protect those who are too young to be vaccinated? Any reminders for the kids?
Well, I think you used the right word. We have to remind ourselves that this is not over yet, that we still need to use very good social and physical distancing measures. We need to use masks when it's appropriate, and we need to just be a little bit more careful a little while longer until more and more of the Massachusetts population gets vaccinated. We should really be seeing some very good reduction in total virus in the community as more people in Massachusetts get vaccinated, as has been seen in other countries where the vaccination effort has really progressed well.
Earlier in the pandemic, infected children seem to be often asymptomatic. So has that changed? Kind of what is the severity of the illness that you're seeing in younger people, and any concerning kind of side effects? We know we had seen, certain rare cases of inflammation, things like that.
Yeah, so far it doesn't look like the incidence has really gone up. I think what's happening is that we've become more and more aware of the fact that children can in fact be infected with this virus and can have symptoms with this virus. So we're testing them perhaps a little bit more precisely and more, with more attention than we were before. But so far there isn't a lot of evidence that the virus, as it has evolved, is becoming more dangerous for children so far in the U.S.
And finally, it's school vacation week for many. Some schools are requiring students who left the state for more than 24 hours have a negative PCR test before they can get back into the classroom. What's your recommendation for parents? Should they consider a quarantine in addition to that test?
I think that a negative test when you've come back from your trip is a very reasonable thing to do. It is important not only for the individual to know whether they're infected, because of course that has lots of implications for their family and for themselves, but also it's the right thing to do for the school and for the community, because even though the child may be relatively asymptomatic from the infection, we certainly don't want that child sort of circulating in the community until the virus is gone. So testing after travel, I think, is a very wise thing to do.
Okay, Dr. Rick Malley from Boston Children's Hospital, thanks so much again for being with us.
A pleasure.
More struggles for a